Our next speaker is Judit Takacs, who will enlighten us about two important challenges for people with osteoarthritis, and that is balance and mobility. Judit.
So hello, my name is Judit. I'm actually a PhD student in Dr. Michael Hunt's biomechanics lab, and I'm very excited to share some of the stuff that we've been working on in our lab. I'm going to be talking about falls. So just as to get an idea, how many people in this room have either fallen or is that something that we're thinking about or have done in the last year? Hands. Okay, so quite a few fallers. Okay, so this will be something of interest then for quite a few people here. My interest is in balance, mobility, and falls in adults. And so we're going to talk about falls first. And the reason for that is because falls can have a serious impact. They are a leading cause of injury and a major cause of hospitalization. And so we know that they can cause injury, but they also cause problems for long periods of time after. So as an example, in one study, 32% of those who fell, older adults who fell, needed help with basic simple tasks after they fell, things like making meals, dressing, going about their daily activities for months on end. So the impact of a fall is not just right away, but it can continue for a very long time after. And so what we want to do is we want to reduce the risk of falling, which is the opposite of what John Reynolds here is doing. He's an acrobat from the early 1900s who I really like seeing all the pictures of. He's increasing his risk of falling, and we want to do the opposite. So he's okay doing this, though, because he has something that's really important. He's got good balance. And so we're going to be talking about balance, and the reason for that is balance is a major contributing factor to the risk of falling, and it's something that we can assess and we can treat. So you can change your balance, which is not the case for all risk factors for falling. Some risk factors like age, we can't really change at this point, but we can change your balance. We can affect it. So we're going to be talking about balance problems, how they can be assessed and how they can be treated. And in particular, I'm going to focus in on dynamic balance. So that's the balance you use when you move around, because many of our falls, the majority happen when we're moving about in our community. So dynamic balance is what I'm going to be talking about. And how does this relate to osteoarthritis? When we poll people or ask people if they've had a fall, very similar in this room, about 50% or more who have osteoarthritis report that they've fallen in the last year. So that's higher than if you poll same individuals, age-matched individuals who don't have osteoarthritis. So there's a higher rate of falling for people who have osteoarthritis. And so this is something that we're concerned about, and now we ask the question, why? Well, we know that people with osteoarthritis, and knee osteoarthritis is the population that I'm interested in and that I work with most closely. We know that they do relatively worse on tests of balance. So if we test your balance, if you have osteoarthritis, you tend to not do as well on those tests than somebody who doesn't have osteoarthritis. And that's related to things, many things can influence your balance, things like your muscle strength. I know that Dr. Saber and Dr. Hunt have talked about muscle strength. That's important. Also your body awareness. So your body awareness or proprioception is your ability to sense your limbs or your joints in space. So it's being able to tell where your limbs are without looking at them. It's your other senses. Also things that are important to your balance, your range of motion, so your ability to bend and straighten your joints. And then for osteoarthritis, pain can also affect your balance. So there's all these different effects for balance. And in osteoarthritis in particular, many of these factors are affected. So not just your balance control, but all these factors that are associated with balance. So when we look at this, especially when we look at dynamic balance, so that's your ability to balance as you're moving, what we found in our lab, when we bring in people and we look at their dynamic balance control, things that are especially associated with it are muscle weakness. So having muscles that are weaker influences your ability to control your balance. As well, your knee range of motion, or your ability to bend and straighten your knees, influences how well you can control your balance. So these are some of the things we found that are really important. And so now, how do we recognize if we have some of these balance problems or factors that influence our balance? It's important to talk to your healthcare professional, but there are lots of tests that can identify problems with your balance. Some of them are simple tests, things like standing on one leg, seeing how well you can balance on that one leg. Some tests are made up of more components. So the Berg Balance Scale is a more common test which has more components to it. It has 14 different tasks on it, things like, can you stand without falling over? Can you sit without falling over? How about, can you walk in a line, or can you stand on one leg? So there's all these different tasks, and then there's an overall score that you're given depending how you do on all these tasks. Now, my interest has been in the community balance and mobility scale because I'm interested in balance when you're moving around, when you're moving about in the community, and the community balance and mobility scale will identify advanced tasks that require balance. So the scale is made up of 13 different tasks that are much more advanced. Things like, can you walk while you're walking? Can you crouch down? Can you pick up an object? Can you rise at the same speed and keep going? Can you turn around while you're walking? How about hopping? Can you hop on one leg? Or can you shuffle or cross feet without stumbling? So it's much more advanced tasks, and those are important because we want to be able to see whether people can do these different tasks and see if there are differences in our balance and identify any problems with balance. And so in our research in our lab, what we found is there are differences. So as an example, I've got a graph here in the corner of two groups we had come in, people with and without knee osteoarthritis. So these are age-matched individuals, so same age. And what we find is that people without knee osteoarthritis score about 85, so the maximum score is 96. Higher is better on this scale. So they do pretty well. People with knee osteoarthritis score about 15 points lower, so they're scoring quite a bit lower on the test. So that's important because that means we can recognize when there are problems with dynamic balance. Now, what to do once you have recognized that you may have, or you suspect that you have a balance problem? It's important to talk to your physician or your healthcare professional. They can help you because we do know that there are dynamic balance training programs out there. And so this is where most of our research is focused right now. Dynamic balance training is training our balance when we're moving. And so there are different programs out there. Things like the Otago exercise program is based out of New Zealand. It's mainly been tested in healthy individuals, so people who don't have clinical conditions, osteoarthritis, things like that. We know that that improves balance and reduces the risk of falls. And so that's a great starting point. So what I've got up here, this is a forest plot. What it's showing is that there are several different studies, lots of different research behind dynamic balance training. So these are all different studies. The important part is that the results of all these studies are to the left of that dark vertical line, showing that they all find benefit to dynamic balance training. So in those who don't have a clinical condition, we find there are advantages to dynamic balance training. So they favor exercise. Now, how about if we do have a clinical condition? We find that there are benefits in some populations. So some of the ones that have we've looked at for dynamic balance training, stroke. So if you have a stroke, dynamic balance training we find helps your balance, reduces your falls risk. Same with if you've had surgery to your knees, so things like anterior cruciate ligament reconstruction or total knee joint replacement, dynamic balance training tends to have an effect on your balance and your risk of falls. Now, how about knee osteoarthritis? Because that's where we're wondering. We know that they have some issues with their balance. Now we want to work on those problems with balance. Well, the short answer is we don't know. That's why we're here. We're trying to find this out because there have actually been very few studies to date that test dynamic balance training in an osteoarthritis population. And so we're not really sure because some seem to suggest that maybe there are benefits, some say we're not sure. And so this is actually what we're doing right now in our lab. We're running a randomized control trial of balance training, dynamic balance training. So this is just a tease, I know, but this is me doing the exercises, some of the exercises that we're running in our lab. So it's a 10-week exercise program, and what we're testing is whether these dynamic balance training exercises will have an effect on dynamic balance, on physical function, on pain in people that have knee osteoarthritis. And so because the study is ongoing, we can't actually talk about the details, but I can tell you some things about exercise and what to look for if you're considering balance exercise. So it's important to talk about this with your healthcare professional. They can help you figure out exactly what works for you. But here are some tips that we've learned along the way and that we're learning as we go that are really important to consider about exercise. First thing is exercise. If you're looking for dynamic dynamic balance exercise, you want it to be weight bearing. So you want to be standing, not sitting, which is what we were doing on all our exercise breaks. So we're off to a good start. You want to be standing because what we found so far is that the non-weight bearing exercises, and often traditionally in knee osteoarthritis research, non-weight bearing or sitting exercises is what we've been prescribing. But the standing exercises or the weight bearing exercises are more effective at improving on your balance. So weight-bearing exercises are very important. Also dynamic, so we want to be moving. So again, that's something we were doing. You want to be moving your legs as you're going. You want to make sure that you're not holding a position. So holding exercises, that's what's called isometric exercise. We find those aren't quite as effective at improving your balance. And that makes sense because we've talked about how most falls occurs when we're moving, and that doesn't translate to movement if you're holding a position. So you want to be weight-bearing exercise and dynamic, so moving exercises. And finally, you want your exercise to be multi-directional. So for instance, in this exercise, I'm actually going side to side, although the picture doesn't, I'm not moving fast enough to blur in the picture. So multi-directional exercises, you want them to be front to back, side to side, in all directions, because that's what we do in our daily life. We turn around and talk to a friend, we change directions, we go forward, sometimes we go backwards, and that's what we need is exercises that are going to translate to those movements we do when we're all around in the community. So we want our exercises to be weight-bearing. That means standing, not sitting. We want them to be dynamic or moving, and we also want them to be multi-directional. So these are some things to consider when you're looking for exercises, balance exercises, and talking to your healthcare professional. And I just want to thank our funding sources, CHR and the Arthritis Society, and the support of the Mab Lab and the Garland Lab.
You acknowledge the fact that it's a reasonably new formula that you guys are working on right now. Is that out with the physios and everything now? I've never heard. That's completely contrary to what we've all been told. So.
Right. So that's a good question. For the exercises that we developed them in concert with physios. We worked with doctors as well as exercise professionals, so some personal trainers as well. So when we were in the development stage, we made sure to include kind of all the different healthcare practices that we were able to. And then that's one of the things that we're looking to do is when we finish the study and we've got the results, I want to make sure we talk to the physios, and we've been talking the whole way along, but we want to tell them what we found and share with them so that they know whether they can use the information that we've got. Yeah.
Well, out of curiosity, what's that New Zealand exercise program you spoke of? I'd love to Google it.
It's the Otago exercise program. It's got a funny name.
Yeah, how do you spell that?
Otago, O-T-A-G-O, and it'll be in the slides when they come available online.
It's got great research evidence behind it.
Your criteria, weight-bearing, moving, multi-directional, weight-bearing would seem to rule out aquatic exercises. A lot of us do a lot of aquatic exercises. So what is your position on that?
Aquatic exercises are great. They've been found to have, for strengthening components, similar types of benefits. And as well, some of the research studies have shown that they have fewer adverse effects. But when it comes to balance, and dynamic balance in particular, so your ability to control your balance when you're moving, they actually don't find quite as much benefit as overland exercise. But that comes with a caveat because there are very few studies that have been done to date. So we're talking a handful of studies. So with more, we might find that maybe there's a new approach that would make those just as good. But they are good for lots of things, including strengthening.
I'm wondering for the study that you're currently recruiting for, so I have OA of both knees, but it's quite advanced in my right knee. I don't know that I could do all of the things that you're doing in your study, so is there some way we should know or could know from you now whether we would be accepted in that study?
Yeah, so that's a great question. For our particular exercise program, we're actually doing progressive exercise. So that means we don't do the same exercise for 10 weeks, but we're starting with one set, and we progress them and we change the exercises to more difficult ones. So some of the pictures were some of the more fancy exercises and some were more simpler, but we do have a screening process at the beginning where we have you come into our lab and we'll do not just a screening of pain, but also of physical function. So we'll do some tests of balance and mobility and all kinds of different things to see if the exercises are appropriate.
Thanks, Judith. So if somebody has OA and they may have limitations in various aspects, how do they figure out exactly what they should do for them on a daily basis or a weekly basis? Because I think sometimes it's a bit confusing. So there's new research coming out, which is great, but that's partly overturning old, beliefs about the best way to do things. But as we learn more and more, there are new things. So where does someone go to get a program for them?
Right. So the best place, I think, to start is with your healthcare professional, and that's one of our goals. That's why we want to make sure our results get out to physios and occupational therapists and other people who work with people with arthritis, so that when you go to your physio or to your occupational therapist or whoever it might be, they will have this research in front of them and will be able to help you design that individualized program.